addiction. Yehu the addiction the difference between addiction and a habit. And afe ye can the various forms of addictions you will call us so much margin day most so de mo go through mo various addictions by and ye didi hon komo kakra esunsun sanso ebone a ewoma efie ene abusua no se obi eye alcoholic obi atonsem ontimi emfiri mu anase enubone ananse eye porn and the various addictions you discuss ye share sunsun so bone a ebetimi de abreye school na wo kwa ebetimi ama wasan wo kwa mu adwuma na wo ye a untimi enye productive ntibia na yi wadi wa adwuma so a edika na bebre wo efie sunsun so wo fie financial constraints e de bebe fie ni ade ene we want to center more on how to move from your addiction. A bad day in addiction, no, you're free home. A bad day in addiction, no, yet me a jai. If you say addiction, dear, ye ujaya ye others are various, yes, it is a and son no, uko baby, uko herbalist or the dro ana bibi no dia fra adekro na sensa no ya addicted to a no dia fra na wo dia maw iti odema wo beturo up sebi monimu a wo befe e free ho no onko nsa ho biem to say you will ebi sempai but deliverance etimi tutu ebi si just a medical condition ebi so say e just a word nipa no oye wa adwene say ade na wo ye no ompe na opese wujai iti ene that is what we are going to concentrate much on. Now, as usual, the guest, many omo ye edi jumedi last week, omo anene me sign omo esinkonya. Already, no Reverend Emmanuel Abuaje, or a senior pastor, Gift of Hope Ministry, Gift of Hope Christian Center. NOA CEO for Leadership Agenda is already in the studio. Waba and afe Mr. PV John Datson Boateng, development consultant, a politician. They say they saw a career coach and oye lifestyle account omo no omo ahead and no Astral Citizens Club was your president and so marriage expert or a counselor to say the period to oppositions in corner home. Sir, na Mr. Thomas Obobamfo Jr. or a clinical psychologist Department of Psychiatry komfo anoche or no so ebeba bekaye ho na obetimi ahwe yen Pure FM TV on Facebook and ye WhatsApp line no so ye 0240929283 and no yet the other WhatsApp messages are now audios ebefaso na me baby phone lines in person free bi tre wa adwene dia 024 no 0240929256 0249299256 mene omo bo me omo time echi no me production team no neck website mami esibafo adwoanya akwasiama Yunus Ejare Portia Clifford and omo kika ho ene boama ye di dwumadi na bro da bia no omo so ya se Ancora Homes Kumasi latest gated community a luxury comfort security ne privacy safety assured IPT junction e see boa and afi Angel Cola the enjoyment cola and aso ya se ye de efisem ebrew anopay men say bre no me person me phone lines no so na as usual ye fa a few phone calls and be studio discussion no unim bibia ye timi atwe ho free addiction ho ana obetimi aboa ye see a solution to addiction there you betimi aye a ebema ye free your addictions ne ho because ye nyina ya gia to me say addiction enye papa addiction enye papa about 90% of them eti ene ye hwe say e de enye betimi aye a free addiction ho. Hello, good morning.
Good morning, hello.
Me facho udi ni baby akasa free.
Pacho me did in the basic.
That's fine. Pacho maminti you.
Last week, me tape, it was a customer who repeated buildings on Oboa Missa, and Magic Parano. Now, they do and say, my years are addicted in the from 2003 to 2015, masturbation. Yeah, for so many years in Nami about that's not masturbation account. Until you maybe not say it takes you on seven with the books and mom say, Mamma, like, woman with action. Until it's a bit semi die. Women in the neighbor is also come cry with a washroom crab up a year. I can't be key up at 1 day. But now don't like a man do I actually a man to me die come. It is 2013 visa made it.
Sweetheart, it's a dear na ya ema utimi ejai dear bibi na to yes obi o ha go through an ordeal addiction in Emma addiction man go through an ordeal na aboa na manetimi ejai den na wo de ni utimi jai
the name share implications in a one for future and me say woman.
Okay.
Now share yes ebema obetima mo abadam ebetima ma wanya lotion count ebetima wanya ade no bada this year no wanya o ba and I say kono funi man ntina shedi wezi na the wa music kind na me read books na me say what the one say masturbate and onko and that kind of a free sebenya and I say no ba so akabisa free sebenya they compare me no na say the implications never wanna na no say mo me na dey but that time I'm going to be that meeting me about 10 times or 4 times mine I can never 4 a day I say no say about so na unya problem or angus static free angus so tina ama wo problem ka won tam je de bana na me share mo ami ntina na meeting me force ya by the chairman no do chairman side ma we no di pa no chairman no what didn't want to chairman and to market e kwada to ma ayeni de na ne by na me see o see me no and one on am ya addicted some na and to my animal be na me dey
wow. Yeah, that's a part of place only a share or experience. Thank you so much. 02409292560 02409292560. A day and na we are addicted to now. If you say a day and a boy, you bet me a movie a free addiction into so what experience I share with us. So when him dear so now on a 02409292560 02409292560 and ne on FSM ye discuss addiction na and ne concentration no is purely on a queen befa so you be free addiction 02409292560 calls ni bim dia na Kamako studio already producer say me nyana me fa calls ni si okay hello Anjagoto what set ni kakra ma me boss
morning
good morning boss pacho maminti o
Idinde Richard Yaku
okay
Mr. Kasafri Nyanchenia
okay Mr. Yaku
yes taxi driver
okay
I'm sure you there I'll be almost 6 times so yes munya hu bibi na me ka say Sunday kura mo betimi sade amba Sunday you kra e wufia e be boy fa
pacho ma me akoko ho to kakra
masti na the American they say addiction on so person tru hu free bibi hu a this will determine your mind so dey we mean ko hu na o dem o sre obade no da bia o sre obade na no account point ni dai enye sade a ene adu be ko wu echia me ma me baby one rentals me ma me abna se wa And I'm so catcher can come say the channel said then one can't say now.
Catcher, made us 0240929256 0240929256. Hello, good morning. Hello.
Good morning.
Pacho, we didn't baby I can say free.
Pacho, let me have my name, Kakra.
That's okay, Pacho, my mean.
Let me say, they are addicted to smoking. 1959, 59. Quite for material Cameroon. Let me smoke Bagana 85. Then my bontana. That's it. This is a tough form. That is a cook black. One of the graphics is on me by and the grade film. Which is it. And we say something. And no, man, here. And you be having. In fact, yeah, advice me, yeah, let me see. But the fashion to know me, you know, then we say something, you know, for no one to be busy. Nicotine also. One of them, no.
It's not nicotine, no, na. Abobo minimum ne pie bae. It's now smoky cigarette me boy.
Oh, the starting smoking na the top Toscan new capre. And then that's what I'm now 81. Oh, it is a determination plus ambition. Oh, so what determines over here? It's no more the American advice and women say, if you will be able to say, I can determine that we can stop it. And nothing is impossible.
Medasi Paja, and Patronasi say, what do you say?
I'm 81.
81. 80 59 na ujaye. 59 no na utimi jaye.
Around that time.
Okay. Yeda nyankopɔ asese obo ho ban abesi sabre. Yeda asepa so ne akwankyerɛ a wode amaye. Yeda ase nyankopɔ nhyira.
Amen.
Okay. Eja se ono nicotine bibi free ni throat na epie to form. Na ofa ko fie akire no. Let's say ohu ade corona bibi tun ena enoamu ena odi ejai otimi jai nti o feel say determination we determined say the crown ubejai a ubetimi ejai. Hello me pacho minti o
pacho sama abna kasa feature patre
okay pacho minti
ya kutomu na macha
ya enua
e pacho e de minimi say ade addiction de say o sa de lampa ni fo na kan wa wudi tem o pe taso ni taso enen pipe na betimi am dan last week no lady bi ka se sile sile e kwad me fa so no me na wuma bi de na mi kosko man kwatia na wuma bi na ni tifie na odi on no osuma me oyan ma pano ho the choir de shepa de fast no enya atum kutua me de me tona kase na sa no ye me de ntino no so na me pu me boom na me de bia to gym na ehun na ehwam eni se me ni we ni hie no na gym de no so aya the basan so o menstruate here say tam no kwan so na eba complications de no be bre na we chile ho na madam for the mama jam to kwan me kuma family to kwa Israel na menya bi they say treta kitwa enya fun kitwa ni wotu me wo so na me fe let's say me bas e de ma semini me am so mo ntimi so mfa be mbra me wo no because abafi mo ma so mo nkoye am premier mfama na tie sa de no so ne sen enti de me en se fe na me su milo tofe no milo tofe do ma cake no eni de na kota na e kamia me yi ato no me wa adwuma mo na me yi adwuma e kamia ti de bie ne bi wo me ho na me de mpa bossa na madam fu bia na me no on so edi me tie ne Ghana said ono de se abobo am se o yare ya me ko hospital da fu ya do no me se fibroid omo ko ya so na nya no a o ko ya doctor say na tie wo ada o ye wo
8 years
so na tie wo no mo jemu nyina o me se lady na wo no ya kwapum ni
that's sad.
Me tie no me say akoso ma shey kuno already ahwa na ne fine to me ba me bisle me hu say obi dia me bit meje to na come to asu omo mo nim me pa say kuto omo abra sala me say come on me yeso omo ti ase enye na de make e ka kwesi na say eso utumi show ho so show ho so mo dia now the pabo kan ho a obetumi aja sa na de san pabo determination that's
Miss Meda CP e ha na de course ni besi na memra studio Safo good morning na hot is it
ready adum pacho wan say
nyankopo adu oko Uncle Thomas it is say
ready adum madam
and I want check up and I want that glasses
was say and maybe me free by it and me free it
hey
oh me I think tell me my I was me too kind kaka me dry you know feel cry
that's kafra ready ya mwanko
so
okay
me dry no pay
okay so for me free and last week you can the various forms of addiction and you kika ho some the e kofa ba the ma enkrofo ya addicted to BB to me e ka kire ye omo outreach nema wo mo ye di ho nkoma and then I want us to concentrate on the remedies beyeden and yetimi free addiction ho we yes of we me bisa say empaibo any deliverance etimi ema obi free ne addictions one
absolutely first of all I say it is possible to break addiction nyankopon ono ani nyansem and wisdom mu will make you remedy for everything. There's nothing that is impossible for God. You have to understand that. And when I say one accept it first, say no matter the situation, there is a way out. We a Christian near Bible like I say, spirit ne raise Jesus from the dead ne lives in you. Obe equipe with mortal body. Obe share with ding. Grace. Should I say o Nyankopon ahon ding. It's the ability of God. If you have grace, it's the ability of God. Which Christo ni the ancestor of Kase. We are addicted into. We are not slave to sin. Sana Bible kai. To be sent at TBN. What the show to me say? Me to me are breaky. Now, yeah. So no, the possible. I mean, we are believer, and even if you are not a Christian, from professional point of view, it is possible. To break that. My name say what's having cost steps now? Now I say that's
yeah.
Okay.
80 young koso.
Okay, so into one of the people we have dealt with, or some of us, even our own personal lives, things ebia enyaman kitinkiti ana yepesi enja yenyi onyamimu ni yin. Number one thing is that you have to acknowledge or identifying your problem and diagnosing your problem is very key. Say, oh, okay, I deal with my mingin to me say, I feel there. My addicted. And ye be and ye for only pleasure, my very, very addicted to this problem. Until I have to deal with it. So to me, identify that and I acknowledge 50% of the problem is solved because you see, one make you wild dream and psychologically, you are poised for a solution. Now, one of the things where I say won't accept it. The other time, me share a brand TV and one visa. You know, I'm saying him for now soon. No, see secondary school. He wants a way out. But the American chair and say number one idea say when you say who say a won't talk. It's a battle I wouldn't work with him. There is a price to pay for all our actions. And then a mama in Kofu be bring to me break addiction. Or person but he's not ready to pay the price. You have to pay the price by with self-control, sacrificing, pains, withdrawal syndromes. The things you will go through, you have to be willing to go through it for a season, so that will be to me an escape from it. The third thing I would add also, apart from say, you have to understand that you have a price to pay. You have to acknowledge, you have to understand there's a price to pay for it, for that addiction. Number 3, most of the addiction issue, is a lifestyle. Once an guy can say, no, I call baby. Woman no can say or call Israel when you access. So there's a lifestyle that is always exposing you. Minimum be why so addicted to cook.
A drink cook.
Yes, cook.
Me at a point I think say na me addicted to Coca-Cola. To say seriously but me who say emwa me pressure ne ade no.
Yeah.
Me de Milo, chilled Milo. Yeah, I know I chilled Milo anom. But actually, and also you have to replace it properly. When you addiction without replacing, it's very important you replace it. There's a scripture in the Bible that says, "Do not be drunk with wine, but be filled with the Spirit." You have to replace it with another lifestyle. One say, Jesus ma some say demon bi wo mu na yetu demon na. Demon be kwa kuchia oba na ho no ye clean still like oba ko fa 7 more demons more stronger. No ma be possess you bi. If you come out of a lifestyle be am fan say bia onum no monsa baby na wo kono say wunja hoko. And don't go and be staying a woman, but go and replace it. Be busy, pick up a job, join a fellowship, join a group. Mama, you don't get the time to even go to where you are. Minimum be also addicted to pornography. When him, a man here addicted was because you free or fear they be all them. But onye ejumano, onyamre, ko ejumana na pa. No apon ajo obeba no abre minimum obi so a woni say ntokwa so addiction dey so for say mate obi say na yere konkonsa kese ubehu ani ebo mo apartment e wo mo flat epono obekwa akobie no oba na akodi konkonsa oso omo te an apartment mu a chese abrochire o enso so na kese abrofo na ye konkonsa na yere no chese the bia na confronted oba no because wakoka ase obi so I say or no dem feel say obsession she's obsessed with me kunu no enti entokwanko obi a obehu no say the kunu from afa ho kra no to say entokwa ebi dey na again to say but as PV was explaining at what point na addiction and answer a habit. Also, the habits in the Ujaya and say Kenya and din. As I be
say habit is a healthy BB Emma with me BB with a free will. Without once a different from discipline. Discipline is exerting willpower. On Zebia, but say me for a season. But I know aware of or bit my discipline not to at a certain point, but our habit amount to me coming back to it very easily. But addiction are overpower. So I overpower wa o withdraw cry. Unya withdraw was
na konkoza ho take ya chew.
Minimo bia na ono oni ni kuntokwasa ni kusa nti ni kunu going to seek help. And a counselor ni bisa ni say ni ri edwuma no no se there be no say o mo pay edwuma man. So two of them work together sa no mo nye edwuma man. Edwuma matron edwuma bi man. Afi lady no bebe fie no wa bre no wada. Ni kunu ni nya na sumwie.
Wow.
And see, always, no, one of the things to deal with addiction is to replace it. Baby, before fro, na ye. And I say, you go away from the thing now, Emma will addicted. No. Because I mean, Obi by no say, or yeah, addicted to. We speak to a lot of people who are addicted to pornography, or a doctor. And Obi say, how should we make us a doctor so that people know structure of life people can have this problem. And I may say here or explain here, then I may say you are not addicted. I don't know any old day any addiction. And I'm saying the camera is used to see for example them that camera obey or say there I'm saying now you're addicted. Because addiction, you don't care. It was some of these things. No, be one more. We do stage be addiction. Did so. Be one more extreme addiction. He would need to move him one step at a time. Some very reduce. I didn't say I could see timer. I bet clear off. But Oceana, the idea is come for one year. So that is how you escape. We are that type now. Go to places. Make sure you are not alone.
Somewhere secluded.
You are not alone, and now find something that will engage you. So busy, such as say, oh yes, and give yourself some time. Oh yes, to some time. We are going to say afe no. Na the thing na be devil na bafom.
Medasipi Reverend Emmanuel Abuaje ena ote nkana. Mr. Olav.
Yes, madam.
Addiction, yet we free home.
No correct. And my main
free addiction.
So person free home, bet me free home.
It's a crime ben so na you bet me a fast so, you bet me a free addiction. If I say the serious, no, alcoholism, substance abuse, be a masturbation, a crime ben na obi will be no tia no pay. A quite ben also faso. And now, do we need the help of Omo Moye?
Okay.
Ye free home. Ye hear more for be. And I inquire strength and your willingness and determination to stop nebit me am ye free home.
Okay, me da se be me chia etie for so. In fact, my main started from one or two things so for can then I come to me question and answer. In fact, say you can say addiction ye bomb to us ye boni deliverance anka. It means there's no connection with medical conditions. Because addiction now you can is something that has to do physically with us. Unless you catch them say in Africa, as we call it, in Ghana na you wano, ebi ya tona amano, a spiritual thing. And we dey, okay say, me sofu na me who said ya to amana me minsa to so na and if you na ko ensadwam honhom metu afru so no munsa biem wi honhom metu afru unless say saa bi na wo ka ho asem sente sa na say it is what we are talking about here. It has to do physically with the mechanism of the brain is this is where we have problems with them. Most of the mental conditions mean for addiction I face it currently. Obi be china na me ko software na me ko dunsi niwe ho and osi me nyese no obompa ya mame no osi efiri me fie no ye twem at the long round no osan create a lot of issues between nipa na all suffer no ne parents ne immediate family friends bi anka mu betimi aboa no akoka chwa ni se obi kra na eye unti ye mompa ye maso mesi na enfiri ho no mo na eda nipa ni trip nti nipa anka wo se o timi ben boa no na watwe ne ho na nipa na esofa me catch you say nipa bebre ne nama bonten boys here num wi ni sa na ma no ena senka enye sebi oni ma mu ko tibia bebre mu ko mi ena enye sebi asofufo a abai eni ye no mu nsenka ye bi omudi ka ka kire omo encounter omudi ka nya ya enkomo enru ba bi omodru no
enti o person kire say asofo ni bi in futuo ni omo a direction counseling
in a way
and prophecies
in a way it caused some of these issues
a many ways course they say no na be course but
it say nipa na start course at be anim na possibly I was enkomo directing to the right channels no they rather cause it they do na ma in as much as
spirituality
the idea ba ko was say asofofo no nso te ase ni say me na me ba wo ho no a me go through problem no say a spiritual or now a spiritual person have a fine way of dealing with that say wo ba ya so ya though ye ni omodwuma no in a way e ben kakra but we don't deal with the spiritual aspect say wo ba na say problem wo ho no mo a yenya abotrema enchiechemu ba ma wo te ase de ekoso psychologically na wo hu say a problem no omunzu nya abotrema asori manu ana omomobo mo na ase se wo hwe na se wunya saa time no nkyerechire ni mu e ma ne hu akwankyire na ase ne mapa wo se wo de boa no na enko keka nsem bebre you see they based on this psychology say omode ehu to nipa bebre so se me kan nipa bebre ba ho no ma because of some of these things omabra to scare gua enya sofofo ne nko e bi come alamfo ho adunsifo ho na ye nkonya bi ne yi ne ma bi firi mu ho ase ye wi ko ba mi ho a obekọ no na the same problem still persist into asofofo ni bia ba nei no enso cause ma problems aye kan ho asem eye kese enye omu nyina but owi a wakase so komawie sofo kan asem bi se o wa ankasa no betumi aye se nipa ne betumi aye in fact enka o nhia moa addiction is a problem.
I believe you said with determination.
To say you are going so be addicted. Free psycho adding. You go and you come back. And you're not in addiction stage. Whatever the problem is, no. Say nipa ni addiction stage, there I don't have problem. Obey to me, I'll go through. But say nipa ni addiction. On to me.
The amount of professional help, Krana, it still bestowed on you.
That is what I'm saying. There, to me.
So we didn't say but I'm a psychologist. I'm a trained psychologist. Mm-hmm. I'm not saying it just from. Mm-hmm. I'm saying, sir, at the end of the day, whatever prescription, so I want to say the kind of therapy you have to give even yourself for it. I remember one of the reasons why many people don't come off addiction is because they are not ready to pay the price for it.
Because they don't know what the price is and how they should pay it. You see, last week,
the thing concerning a software, sometimes individual because software. So on your professional like you are, how would he even identify say this is the problem?
That is the where I'm coming from.
So it's an education to the individual. Individual. No. Look, you need God in everything. So
I'm not disputing the fact that we need God. So don't get me wrong there.
No, I understand. But what I'm trying to say is beliefs are something that also I've seen doctors, patients about Munchamo say you do it, I just say and so we share with that.
Oh yeah, some doctors refer patients to.
No. We
are suffer.
Yes.
It happens.
You won't be able to.
That is where I'm coming from. Say, oh yes, suffer now. You get to some of these issues. Refer appropriately. Sure. You are suffer for Brian. You mudi Juma. Obi ono mukra prayer camps. Me pese me bo baby. They call us to come.
They say. No.
You can't
discount
the
fact that
those who know how to handle it properly. As of for baby Friday, there are places in person baby they call us day in day out. If you want to cry, a counseling session now, big nipa baby nipa. We go there, we give medications, we give them injections, we do everything we need to do, we psych them. And then after that, I will get there when I come to sa partner. Yenti sa asemnase. Obi a will go through addiction and kasano. most at times and last week I say at a point they realize whatever they are going through is a problem. Obi on kra onye na adwin say obese ojai kra. And there were 5 stages nipa no be go through stages of change. Edi kan no nipa no ema ni trimu da kra say ade na wo kom no onhwe say obejai. Nti say nipa no ka chan say ade a wo ye hawa wono wo hu. Ti say sebio ona woni na mabontin onu no wi ni sa ne man dodo na enya adwin bi say ade na wo ye na wo so ojai. Nti ono sa no se wo pese ojai a even wa kra wa so ne sa de na ba hospital no ana wo de na ba ye nchen say ye mo ano no e wo se ye ne tena se e ma ne hunu huye hia se wo so wono ankasa ye na adwin se obejai. Nti na mega se ono nko antumi chi se obi boa no ohia professional help. They are also mienu nipa na ye na adwin se wa make decision say ade a me go through yi enya de pa emwa me ha ma brabo me hwe nipa etwa me ho ahia ene me nkwa me suban ne me nkwa me ne ya I don't think say e was say me to aso nipa na ye na adwin se opese ojai ohia moa afei no hwan hokra no nkopɛ moa no aha ne problem no nipa no kra agye atum se ohia moa no afei na adru okay let me talk to adwa nhwe adwa kra oka asema obesrew enye yi no ato atwene okay mame ni akosua nso nkasai obehu ni akosua kasa akosua kra ase me ne kasai wa mame mu aye papa bia ento o try baby ba ko mienu na se ohun ni se after all no me ni adwa kasa ya anko ba bia kofi ba me ne sheda ye se de me ni di nkomo me start ne response no kra negative enti ne mame ntenda nipa ni nya opepa senka obe start ejai tibia na wo kom no but wo hunu ba bi pa obenya saa amoa no enti ye twene sign etoso bio ye ni aye Christopher in ye part of this world media ye believe in our spiritual leaders enti be hu se wakọ ne sofo ho ne malam ho spiritualist bi o gene di bia papa problem me go through new reactions e be free ho aba no enti na me cost start ho no so that I will come in here reactions e be free ho aba no na wo elder mua na wo say dey ana yatitu nya misuro mu na tibia wo mu nie na ye hunehuna say nipa no wo ho a ene sa de we de wo we hia se nke bia ye betu asen kakra ana se kotena fie ko yesi enti sa nipa no hwe sa reactions e bia oni na danfo bia di hu nkomo se nya ono kra na ato na wo hu se bia to obi wa sorry nim ana ba bia o finding itself no enti all coming out no ebe ye ne den. There are a few occasions even me find share obi as currently even there is a researcher I'm still on it over the week I've been in Accra na me collected data it's about lawyers and you realize even omukra na sabi you classify omosam you do omu place at a certain level no when it comes to issues with mental health and addiction they don't open up and they don't seek help. Minwe research ntimi nka ho nsem bebre omukra na sabi omoko school kakra na sabi nka bibini a nka ye readily available they can read about it where to seek help no they don't talk about it enti sango ofo we ni mumpo no how much more sabi o ye ni a ye was ye kakra enti hefa kakra na okopembo no obi beka say mikra me nim say and based on nipa kakra me no makasa they don't know where to even go. They are now thinking, say, does some of these things even exist? And if I cry na menko hospital na why was a mikusi, why soon I was a mikusi. These things are getting problems, becoming a whole lot of issues for them. So most of them they quit, and then they are ready to.
But baby,
that has become a problem because onim baby are on fanfa.
One will say concerning having help for addiction. One say I bet to differ on the issues. And not all addictions that are medical. Research be there are different over a lot of factors. Your genetic predisposition to addiction, your environment, your baby, quite my spiritual. So in time because diagnosing it is very important. So we be what kind it is. And yes, look, I had a brother that was having issues and then they thought to say I'm in the psychiatric hospital. I'm going to do no. It took me brother na no hu ye. Ohwe I don't say I dream we am de mami. Mami and oje duro no fa. So you see inti bibia you need people. Sometimes if your own community can even help you come out of addiction. Group no. I'm on the support. Until usually they say it's a support groups can even help you come out of addiction. But if it's a mental health issue, when they are strictly medical, then you have to go and seek medical advice.
At what point does one recognize a medical issue? Until you come to the hospital. Honestly, you cannot sit home and tell me say you are not in the field and obi problem will go through is medical. Basis how they can say that is why see the wadaroma ain't as much and say oba medium wadaroma with them mean cattle kakra nanka okay with them
no what I want you to know is say it's a spectrum you make out into whoever it goes first very key into for instance a bad doctor hoa a bio or health practitioner hoa or no betumi aka say okay adie we there we here therapist we here minimo bi a onya issue it's digress kakra onya issue onya accident in an ibona doctors ni here you know we no catch so you will work within 2 weeks after the best 6 months na still on nante talk doctor and catch and say problem no enya medical here therapist into or therapist or trainer in a trainer and catch and say the reason why I'm not on to me 19 say after the surgery no sanko nya training mentally now renewing of his mind to be able to align his thinking with the new way no my man only so mo bua na na afi not to me 19 into whoever a bass of who the suffering to me who say adie we my bomb pa na nye spiritual thing my bizarre questions me who say bibi a why be addicted we here will be a psychologist now aboa we here counselor but baby edui ebi a we here medical attention enye ni niana in fact we don't even have enough hospital to say but abrochen tisa I mean enye bibi a na hospital. Some are counselors, they are paid psychologists, different aspects. So we have to look at the thing from a broad spectrum. You know, individual, whose education is more with the individual than the people or suffer. So because I didn't suffer might not even know. Many of the suffer who are not go school. You. The ignorance is the key thing. How do you refer? Every doctor, general doctors, no. Oba omunim say adie we a heart problem, number refer to a cardiologist. Omunim say we a mind problem, where refer to obia of brain. Any sign but so onima, how does he refer you? So that is where the issue is. It took us a soft no and refer no genes are spiritual. So where I think can we solve the issue is the education that goes to the individuals. So yeah, it is like what we are doing now. Say me area. Now me say malaria. Why should I go to a pastor say buy my as I know say I can go to a hospital or pharmacist to get the way. So that is the point I'm making. It is not an medical. There are some of the issues. They say my sure research be maybe what have. Oh, chat DP. Oh, mama, 10 different areas causes of addiction. And I'm concluding to you. Or say it is important to understand that addiction is a multifaceted issue. And different individuals may have different combination of these factors contributing to the addiction. And how to solve it. Even some of the issue, even after the person has been to the hospital. Oh yeah, there's another group. A physical therapist, a counselor. They be a conconsa here doctor. suban ina mo ka wa ha no also personality traits has turned to addiction or certain personalities such as impulsivity, risk taking, or tendency towards seeking new addiction. So those kind of things, no, they will need a counselor. They will need somebody who will be with them. Some of them even need mentors. Once there was 7 groups of people, I mean, a seminar, I say 7 groups of people. Sometimes you need a coach. Somebody who is going to coach you to be able to stop it. Once it is one to know that something is a problem, and it's another to know how to do it. Into the whole coaches, no, coaches help you to do that. Into any personality trait that is a me and woman is so fighting and easy. The man that her husband spoke to, catch and said the way to solve this, you pay you mama no. Pay you mama, no pay you ma or call late or bow a breast. Man and can answer. Or say about the Irina Breno and Tahosa, or say quietness. She was not fighting against it. Maybe more. That is why I don't want us to push too much, making everything as though it is medical. Because it is a very broad spectrum. Yeah.
So Thomas Bacho, go on.
What I was saying, not suffer on Timase. He is privileged, say when you knowledge in psychology. Has often for say in our local setting in Ghana has say and there was exposure. Oh dear street imuya umfa area has here nkwa ne nkan asori dan a ye be hu. Ne mu so mo say and I even omako just a seminar on be here sofo no. Omako seminar on psychology and some of these things. Majority of the issues, we sit at the hospital and as a nipa ne banes wo kana sema you realize maybe a work no it's not helping. It is me can say a book wasem na maker. Me anytime when I'm speaking on some of any issues concerning mental health, I go practical. There are times one way me make research finding back. Yes, society now a woman. What we are going through is what I'm talking about. Nyamia na dumono de wenya exposure no. And he's likely to refer when necessary. But as of for say ene wo kromu ha no mo a omo that exposure no. And yenti ase omoji clients neto honomo, they will come with all sorts of issues. Or meji what one mob edi what nasia and they will not do the needful. In as much as say we the me person me try say in as much as say we bibini spirits will honomo. Me jidi. Me bom empire me come sorry kama. And say me nsum nyame me sum nyame. But after say wasum nyame awie na wo bom empire and whoever needs to help you no obo no. Making sure say you seek medical help. And yes, Oba hospital straight away as you when you started over. Said your kind, all started with general process. Even to come to us a psychologist, no, you need to see a psychiatrist. Oba confernochia, you don't just come straight. Maybe I want to see a psychologist. Me who fresh cry, I'll listen to your case and refer you to a psychiatrist. See, sir, is there any medical cause of it? And sana later on, the doctor will then refer you, say you need a specialist care. Go and see this. And yes, psychologists in Kwanyo, we work as a team, especially when you come there on Tuesdays. You see a pharmacist setting, you see a psychiatrist, you see psychologist, you see a behavioral therapist. We all sit and then we discuss cases. In the case be a beba who be an now you're making input. This is how we go about it. In the end, because your setting has the more you go for no now listeners ninya the perception say as of folk can handle all no. You see, by the time I'm bedroom hospital no na say yo and there are nipa bi ohonoma you realize say nke ba ntemo a nke nuru ba bi adru no oye kremoni a menka say ja umpaye bo umpaye oye christian a ko sofo ni nkomo uwie ya bra hospital whichever hospital that is closer bra say baby a hospital no be no you need that kind of services ya available for you they will refer you to the appropriate quarters. Nipa bebre, you know, Second for Noche is a referral center. And Nipa bebre from even the northern sector, south and Eba. So what I'm saying is that maybe I will be an this is where we are having problems now because the last time I was with Catholic youth and some of these things are omunya problem no akoka actually okobone I shouldn't okobonika and they think that we suffer na bompire man that is it but ade na okomu na o man ko bonika no or china ya bomb and ya bompire man or china obey the same thing addiction beto aso this is what I'm saying say to even adopt a behavior you need somebody to help you. And where do you get that help? You're setting has to get these kind of helps and resources it's not easily come by. Nti yenhunu baby pie be kwa nya saamwa no and na me memfa to say even lawyers when it comes to their mental health they have issues where to even go to. Nti yema listeners nti ase say and I make sure say it is high time this kind of education echo more. Nti yema your listeners nti ase and at this time so what sure obi try even these days Sundays people are working but can you know nti sa meboa economy no fine enti in as much say okona so we obesan ko ye adwuma no me enti as say ukọ the whatever the problem is the support group are available for you no utilize it but don't take hospital out of it and yes we buy straight away ni e ma wadru. Therapy takes time. Psychotherapy it takes time. Addiction it's like a cycle. Nipa na yana dwen kra say opese ojai na wa go through no yetimi de nipa therapy mu any antimu say nipa so mesi wa ye fine ye be ma time I dey be review ni ade bi on ma was start here we give some people as low as every day ye be shia for some time ye be dey call as much as let's say 2 weeks time na ye shia na e call na ni 1 month time na ye shia 3 months e bi kra call 6 months obi on ma ni ama no 1 year obi timi go through yes yo every day be abra once nipa na won say wonka wawie no but if free bibi relapse oni beti no wasan to muntintan kura say sram oyi ne ho enyi enti addiction say won kwa betina ba bi say me go through alcohol addiction na manoma me ya ensadwam ono kura no o ma say obepem wa nti wona wote ne nchen na ade bia wo so ne nsade ne ba hospital no oti anye ya obemu bebu it goes across with all mental illness one way ya obemu bebu be jane pa ma no. That is how serious the problem we are talking about is. Okay. And the NTS na yen seeking the appropriate help.
Mesa ba Mr. Thomas Oboba for a clinical psychologist and a psychiatry.
Psychologist, yeah.
Okay. Mr. Jantua.
Yeah.
Say.
Boko.
I said I see headquarters na Ottawa and say
ya upon wasem upon wasem
see ya pese obey o baby a oda na obantem e ho na ya
ni tezen me be na waka me no me ko divisional headquarters
Vivi and your concentration on it's how to break away from it remedy ne eyedie so for ne Thomas akapi yes e bi wo ho adunsini timide moto se de be all the afra adekro na wa ya addicted to no say substance na o throw up e bi wo ha ya de ne kotena baabi na ya ma na hwe se de omo ye enema na o ye ni bi se de asi asai omo na wa sasa every obi o ha tis community ni nyina ye de da hye community ne nsa wo se onom sa wa ha misro ana obepensa entoma no ne ade. How can we break away from the various addictions from all perspective?
Addiction biano has to start with a medical treatment.
Addiction biano
say you were making reference to herbalists no medical man me tetinali en hospital no is yan fan ko din sini ho because we assume say bibi wrong with ni nipadua no. Now nipa your nervous system yadwene and let's try and establish the functions of the brain. What you say as animal way it will be easier for you. Brain, no, one of the functions is it's about the thoughts and decisions, memories and emotions, movements, motor functioning, balance and coordination, perception of various sensations including pain, automatic behavior such as breathing, heart rate, sleep, temperature control, regulation of organ function, speech and language functions. And then so because you say you see enema pia me nkasa so for mo modiro. My remember a clear example be me atia say obi akɔgye bosia wɔ bank na ɔde yɛ adwuma wɔno a wɔn sisi ka na ehye na wasɔre kɔsɔfo. You see, the first step is go to obi a wɔtete kasɛm ho wɔkyerɛ wɔ kwan ne wie na akɔsɔfo fa mpaeɛ time akyi me nkɔdwa sɔfo atwe usika ɛhyɛ ebi na nkɔfo yɛ wɔ sare ma wese ho addiction biara no ɛyɛ medical adeɛ akoto so obi yɛ krɔmfo obi yɛ dwamanfo a okɔgye sɛ yɛ de aduru so a ubegya dwama ubegya akɔ no we are talking say the brain works functions about the thoughts and what and decisions ɛdi enti no bi sika de hɔ debia also no sakoka maami bia na wo ba ko onyinsa na asɛn ne doctor no gynecologist afi wo hu de wonye to one day no kate maami ne sɛ efi na ɛkɔ sɛ wo de aduro bia bɛka wano a sɛ meme mfa aduro no ma wa ɛmfa aduro bia nka wano maami ne nyinsa wonya almost 6 months ɛwie bi wɔ si enitie ne ya no kofa paranom ye onu para na ye kyen na nyinso na hyase to ko hospital one meduro was there bi doctor no bisa na no so ebi aduro de paranam no me na dwen se para enye den enye aduro won se de ye system si work para obi no mani tie ne ya e mani gyae no obi no me ye ne nyinso amana ye den bibia we need to start from the medical friends point of view. Because your system no ade bia nipa ye bia no e bibia ye wrong ye hefa your system no obi di nkonkonsa ye obi wa the system no etima no constitution bi mu a ade a obi ye odwene ho wonti ase eno ye le motoneka ana ye hwie o ye gu nso beko da bi e wo se hu ade ko medical say wo system na no sen isima wo ye den e function adi ntina obi temperamental na obi ntiza entini nyina yenya ti ase o saa ade no na doctor for no nim yeni padua na say the system no esi e work no ye sha say ye ma bibia na won say ye won no bi wa say dobe e say ne kwa ma na wadu bi ye so no ma otutumi kase ade ntina so fon fa o yiri ngugu so ana dobe wa no ma etimi ma we say etimi calm down etimi yo say obi ntimi ne die so no ma dobe ya betimi didi
so kroka ema be ko no so for the you go to so ara to ayeke
ayo
ko beja
ebi ko de bia
say owo ko awa so for awa ne to ayeke
ana say na obi o edobi o mo se oil boy no follow me wunya e de say won pe no say be man di wachi say waji me ko no di wachi te be man so boda mo di wachi
amba
no mo kan we di so nte follow me ne yin
ene pio yenke binti
ayo entino obi addicted to ade bi pe ade no akon system no te wo se doctor for no ne psychology for mu dikan ehwe ne yehu sa ade no eye wono system eye weni ena etima na ye den eye sa ade no then na ya sha so mo fe bibi psychodrama mbato chemu cheme
in America no say uba hospital there are lots of therapies intina ene yenko honum ti nse me kan eni kakra da ye best start say ye fat therapies ankasa in fact ene ma bebre na koso hospital but yeah na ye fan say ukwa ye dru nkwa keke obi onukwa na oba no wa na dru ye na dwen say yeah one of the psychological therapies I use basically depending on the conditions are ena ebe me ya kire say we ebe bo wa na we mo enema ni bi oho no mo a te say de ye hwe akan drama ye movie ye sini ye we no ye wo certain ye create environment oho no mo a we act out whatever you are going through enti say ensa na wono mo a ye ma nipa ba ku mienu mi ensa e play role of ensanom what you say wan kasa wo be ye bi na wo wi a na wa kire whatever is going on no say who obi say na obi nso ahu say enti do me bi kra ta group focus discussion no we use all these things and now they were down for na no then we are no account how he felt and how he's perceiving whatever is happening no they are true now so account they are true no some of these things are there
agodo ade bia say brain ten you are almost close to the solution the way you say na how no if there is a way we bet my brain then attend pet you are on your path to recovery when you do sa point na afen na asofo ne friends and motivation speakers and the album say set a date to quit. Maybe I say my birthday and that's me nya sadi we be because brain na den atene. Then you can change your environment too. I didn't say I was environment now team o yes hard no. And so in a way I was say den then you start distracting yourself. Say ensa me hu sense ya emekwa ha. Me hu madam fu na dey ensa ba me hu na mekwa fe wa
times so obetimi the hobby bi.
Wa unim I go to say brain tania. Who say when a man no say you value the friendship but obepe ko me fa so you avoid him or her.
It's a lifestyle.
Say brain nya tania eno anu no.
And this is not the work of Sebio asofofo mo fa nche me. And anything America say omoji ne ma bebre to omo so any kan so omoji to omo so na by the time we realize na
and on so mo ba woman ni pana kono e anything
so for Gwaji aka say it's because of no so for no understanding
so for bebre nim sa ni me ya kan
me child university yes so for our system ne ye woman ye nim say medicine ye can medicine so a on say Ghana for ye say because ye edru e very broad me boa inti community na ye woman they are supposed to feed education must start with the community. That's the point I was making. In konfo ahe no mu nim say so for na so ti won ko o nim say a problem we say nipa no me refer no to her. They make out as ignorance no war.
And that is community. Where we are doing now. And say no na ye madam. So
that's why I'm saying that o share the light net to say problem na asofo on nko. Then it happens we want the people to understand say who a problem men cause of an change first. That is the issue. When the people change, the also no or your career pastor or your economic agent are winning. You can't sound no interest. This is what you are protecting a profession. You are guiding the medical field. Into the UKBiano has to make sure say people understand say as a member hospital. So for no so sound on also beka. But me it is my decision to make. Say if they all understand they this case a circular platform. Into a can individuals in them say no, I'm say me nya asem one. My main call hospital first. And some who suffer. That is a community we live in. We hear den here in Yama Bebre will be one of my members. It was another branch I'm a pastor church. No because any kuno yare. Inti yako osi ne busu afo ne say there be man in call hospital onye bibi duro. Inti oka say yen konko bompa me do me nyewura dem am say hey never say me fano call hospital because this is when you bibi duro asem. And I'm a na say bibi duro for enye doctors. They are more related to pharmacists. Doctors diagnose problem the first. As a doctor no or diagnose and na your major work or better diagnosis adie we asthma, adie we fever, adie until who or diagnose ma we now decide so back on bibi do as or and they was him. But on diagnosis I don't know let me say fan ko on ebusu afon ko come ampini o. Just some few days na man we. Wow, this kind of notion and ignorance can't be a war community. Now people have to understand, say, Bibiano, your life is in your hands. Who have issues like this? Move straight. Because what I know, and they said, you see, the most safest place to handle this is the hospital. The most safest. So I said, now when you started saying, say, okay, Oba, and you drop any ebemao. Oba, ubetumi nya behavioral therapist. Oba, ubetumi nya psychologist for her. Oba, ubetumi even hospitals no cry. Ghana ha no monye. Abrochi asofo ni awo ho.
Oh, we have pastors we work with.
Well, inti you betumi direct you.
Obi aye addicted on. Obi aye addicted. Onim sa agene kwa ebetumi kunu. But say obi chene sa die we be yosu na adwene tane a. Obetumi atwene ho afire ho. Na onim bibi hwe video mean can say video in minimum video but you can only apply video when there's an empirical idea say ni tiare we enye ono tiare ɛyɛ asorobene ɛyɛ migraine ɛna wobɛnya ahan bi a ɛtumi migraine so onya hunu dose sɛ katem na wosɛ menom se no sɛ meyɛ no a ɛbɛkɔ sisi a ba ne ɔmo mo yɛ bibiduro no mempɛ sɛ mɛbobɔ saa nkɔfo no bitin obi te hɔ wɔsɛ na metwa mpaboa na nyamma mekɔda nwura mu na wɔsom daeɛ ne abayɛ sɛ afidie bi hɔ a yɛde wohyɛ mu a na ɛyi yare no ba afidie papa bɛn na wɔ nkɔfo hɔ a ebi ne kɔmfana twene kwalebu akoto mi bisa o and ɛyɛ amazing sɛ efidie ɛwɔ kɔnfɔlɔ twene ɛne ɛfɛn sɛ kwalebu no so no ebi ni saa herbal doctors na hɔ ɛna yɛtu ne yɛkum nkurɔfo kɛkɛ fɔn kɔ na wɔn kyerɛ herbal medicine kwa usi akoto yɛn hyɛ mmerɛ bi obi a ɛbɛma ne kwan mi na bie herbal ɛyini bia at least the qualification should be a physician assistant yes yɛn fɛn firi hɔ na sɛ ɔbɛpɛ obi a onim ebidu no kɔ aka ne ho a at least ɛbɛyɛ adwuma na obi te hɔ wɔsɛ na mkɔda nwura mu na mkɔda ha na tv fɔ nsom ka ho bi ne yɛyi na nipa bebrebe adua no kɔ a wɔte dɛma nipa nkɔ no wɔnim ade korɔ woma no akɔfa asɛm pii bi de abɛ nipa no akoto sɛ kaa battery kɔ a sɛ wɔtene ta nyɛ adwuma na ɛtumi charge battery no high na affect car no performance a saa na wanhwɛ yi a biribi bɛtumi asi a ɛsi wɔ adwuma ɛnoa no nipa sɛn kɔ anim sɛ adwene de nipa tim no ɛyɛ mmienu the left hand side and the right hand side nipa sɛ kɔ anim sɛ saa brain no the left hand side no yɛ the logical side of the brain and the right no yɛ the creative side of the brain enti patron bo enti no saa nema wei enya bana kɔ hospital ne yɛ kyerɛkyerɛ onima no nyinaa wie a deɛ aka no obi a onim nyansa wɔ ade baabi ɛbɛtumi aboa wo afei na community ne tima bɛyɛ den yɛwɔ aduane bi kɔ wɔ a sɛ ɔyɛ addicted to a friend sɛ alcohol ɛne sex ne mɛbi kɔ yɛwɔ adeɛ bi kɔ a wodi a ɛsa ma ne kɔ soro bani enim yes so enti no addiction no wobɛtumi ayɛ wonya fundamentals no right a deɛ aka no biribiara ni hɔ a ɛnso nyankopɔn yɛ but sɛ wonim ade a woyɛ a ɛbɛyɛ te sɛ Daniel ne ɛfɛn sɛ Israelfo no nyankopɔn sɛ mede mo kɔ nkwaso mu 70 years mɛsan yɛ dɛn ayi mo sɛ nyɛ Daniel na ɔkenkan ɛna wɔyɛ abreast with some time a kɛnnɛ ankɔmda so te nkwaso mu I'm making a point that Daniel no ultimate can ɛyɛ nɛsɛ wakɔ yɛ kyerɛ wo sɛ faha wɔn ebe hu kɛnnɛ msin kɔmda so te nkwaso mu kɔmkɔ no wɔn nya aduane yɛ dɛn edi enti saa deɛ ne yɛnhwɛ ne yie woyɛ addict and last week me kyerɛ mu sɛ adeɛ bi an a habit enya tra habit na wa wontimi control ne pɛ na adane ɛfɛn sɛn addiction na wɔsɛ open ho asɛm yɛ dɛn ɛka biribi a nipa yɛ suban bi a wɔyɛ ho a ɛnyɛ biara no ya na wɔn sɛ yɛde wo ɛyɛ genetical ɛnti na masa ne ma no yɛ dɛn ɛkɔ so obi abɛn na wɔwo na ne ma bɛbɛn a adan sɛ o papa yɛ confirm yɛ ebi ntintim ɛntinsiw no me apa nua baako na ɔkɔka kyerɛ ne papa sɛ yɛ so anhwɛ me onima sɛ papa na ka kyerɛ no so fa nkɔ asɛm fɛfrɛ kɔ no ha yɛ me nyansa me de wo wanka kusu kanka yɛ kyɛ ɔde nka bɛhu adeɛ na wobɔm so deɛ no saa de teɛ nti yɛnte aseɛ yie yɛma yɛ asɔfo no ho ntɔm kakra wɔn de sunsum mu asɛm ne mpaeɛ ne afutuo wokɔ a ɔbɛma wɔ ma yɛmfa adeɛ bi ankɔ state wɔn so ɛnkɔ hɔ ma adwene ɛnkɔ fɔ so wɔn ɛmmom kɔyi magic amadi tuo kɔ a ɔbɛka de sɛ kɔ hospital wɔn mu akɛ akotofɛ adusifo no kɔ a meka sɛ kɛkyima akɔyi ba me na hɔ me na kofi dɔnkɔ bosomfo kɛseɛ pa ɔbaa ɔsɛ akɔyi bi ɔne ne store bɔ ho akɔa na ɛma ɔno adwuma agu tumi na nyɛ bi ma na ɛbɛma akɔa nso adwuma yɛ dɛ agu wokɔnya bosomfo bi ɛsɛ bi wagyi me nyansa ne timu a na ɔkɔ akɔsɛ obi wɔsɛ wo deɛ no ɛyɛ wini ha wɔ ntoma menyɛ wei ma nti wɔsɛ anɔpa biara di ka kɔ bie wo store no ansa na obiara yɛ dɛn abie ne store hɔ wobie so nso abɔ mpayɛ anwummerɛ no twɛn mu obiara nto no store ma ansa na wobɛto die ma wayɛ dɛn wato wowie abɔ mpayɛ psychologically no first sales biara ɛbɛkɔ no hɔ last sales biara bɛyɛ dɛn ɛnyɛ duro biara ɛnibire yɛ mfa duro na ɛyɛ timi sometimes sɛ bɛyie pa me sɛ la nyɛ bɛyie ni o ne mmom deɛ menim ne sɛ wɔne bradeɛ bebree baa ho wɔne bradeɛ ne duru baabi na dan bɛyi afɛ awia baako bon sɛ wa tu no nam wiem because bɛyie no asante kasɛm no wokyerɛ mu a yɛsɛ ɔbaa yie ɛno nti na obi yɛ adeɛ bi sɛ wei wɔyɛ bɛyifo deɛ nti a adeɛ ɔbɛyɛ bia ɔno nkwan deɛ ɛyɛ dɛn ɛdɛm baako ɛsɛ wei ɔbaa yie ɛne adan no ɛna yɛayɛ no bɛyie no a afei dɛ wɔmde di nsɛm mu nti saa nkɔfo no na adeɛ bia dɛm baako 1+1 obenya bibi dia batale de ho a obenya answer ne tools ne de no obenya a feda de bi say mark bi ho a ye de be kan ho de ho yen hye nso enya de ye situation ye ho bibi enya dey enye ya yamna hu debi
okay time no no problem ne eno na time ne yaso because we hear the expert mama 5 minutes the others be 1 minute 1 minute 5 minutes to crab the mama me ode mama be 4 minutes na if I wrap it up what we need to know a beam me sure say be out some no can in let me we are na mako me ofane so for the a final comments
me that's it. You see it's time say was a jitum say as Africans we are notoriously religious according to one researcher in BT ye honhom sem di nti when it comes to your medical side ya totonase sebio broni kromu ntesa ena yesi yesua wo mo si yesua ne ma bia yensua ne ma pa ne ye na ye hunu say anytime bia ye be realize say situation bia ye wom you see there are times nipa bi honuma ohia obi kra ne na di nkomo keke the last time I was making a comment say akolaba ko 12 years okachani ma me say more thing senko nyo obi at that right time no nya obi the right person to talk to her and kai bia wan kwoti bia obekomu mu nti said the moment nipa ne be realize say nipa asumesi kwoti bia bi mu or get himself into subai bi mu or de ne ho bo na amfufu bi ne ni ye bi ahya ase esesa no yama ye nti ase say at that time no ono nya na dwem say opese osesa so onya drew that stage of addiction na in fact even say we realize the crass idea will go through no adwene no there is a part of it a control whatever happens and when in pleasure and in pain it feels the pain it feels the pleasure or consider the immediate pleasure no the afterward pains na ebeba no and anytime be an nipa no be consider itself going for the pleasure na ewom no onim say ade ne ha no pa pains na ewom na no odin price I will pay no eso nipa be bra ma go because of these addiction issues ya lay off from work and e be chase e konfanachi looking for medical report so that yen can be so that they say they be betimi asan ya form wo adwuma mu and we don't do it like that so by be me say go through the process bra hospital na yen hwe there are rehab processes I was here they will frame why you ready are fine Nyami adumi wo rehabilitation centers and then private facilities in so now omo be rehabilitation centers and so eba come whenever you realize a problem no as that here addiction it doesn't mean mobile coding being it Thomas, yes madam
does stigmatization play a role in not getting comfort to a break away from mom addiction? Is it a problem, stigmatization?
It when it comes, addiction has to do with mental illness and mental health problems. And one of the major things, problems, barriers we face is stigma. And anytime we go all out talking about stigma. People are going through a lot. Nipa na go anya problem say go through situations say na nka wose ye twene ben ye ho ne ye tenetene no kyerɛkyerɛ no. That is where ye yinima ni atag no ni amani din no ordinam area mu hono. It is one of the major problem and then the thought of it say me go hospital, me go psychiatric unit, me go mental unit. What say no? Enti na obeba hospital no be go psychiatric unit. Then it means say you where do we mean penny use cry but and the mama mean use abodam for nim me ko abodam for hono mo abodam for doctors no enipa na mpe wona sumatie cry. And one of the major problems I go through and it is time to know say oba psychiatric unit enye say bi omo abodam na ye hwe omo ho ye nsadam but obi ye mentally challenged na ye boa no minim edam na in your society has any ye kan ho asem no minim say the edam necessity but what I know ne say adwene ne ho ka problem ba adwene ne mu psychologically yetimi boa nipa no. It is word stigma, in fact, it is one of the major problems. Because a lady be one of the wards. Oh, no, need any weed, ni cook, ni sani man. Nkomodidi mwakacha mte, oh, nasemi di umuhwe, nasemi di miye fanyo. Unim de we be esia, ibi cry your junk you cry. Nipa ne kasa ultimu say nipa ne yare no. Wasi ne de ni ye. Because the moment obey na you say o ba pe, you be say or ya bodam. Hence own free ni society now joining that immediate environment now. Omu yes anyama no. And it will amaze you say even the colleagues no were even trying to sneak in these drugs or that hospital no. They are sneaking at their brain or inside.
Because take no.
And one of the major issues with addiction is with withdrawal symptoms. Idea anointing so tia nye ye nese one country ma untumi to break away from addiction. Now start to say experience withdrawal symptoms that say obi a wono mo nsapa o man 72 hours maximum. Nese well nipa no ebe ye o say de o ye wu no so onya bi nom ya. To imagine obi a onum coke onum saa ne ma ne onum toni we no se bi nka ne ho a ana on course ate bi anim a madam se o se wo bupuno ni mo na se o ontwa ceiling kra na wo mpie nko a they will try to do it. Ano den papa even say onya intoxication kra onye da harmful to the society. So bedru most at times withdrawal stages no. Me ti say na madam ba ko ka say otu gan ko dru ba bia fe no ofefe no oyese no oyaya. Onu kra den there she has felt it into what she has here. Ebi dia no den chen de ogo mu. Enti say when nya obi amoa was that situation where how can you alone handle it? Anytime we need people to come to our aid. And the best place I will always say, don't go to the pastors yet, come to the hospital. Drew hospital na afi we are sorry ko bo mpaye o time so say you cast a bra reviewer bra na ye mo with that you are good to go.
Medasepa Mr. Thomas Oboba Mfujiniya a clinical psychologist, Department of Psychiatry, Confanochi Teaching Hospital. So Pacho here wrap up me ma just a minute and the minute
the American say addiction enye bibia eye easy sir. Opese won come out of it and free more enye bibia da form. Na you need professional help. The reason is a craftsmanship. You can say bibia craftsmanship and you be back together to be able to solve it. That's na you can o yare now say ko obi oye bibi drawer. Ono hu ye no dwen say bia malaria. But doctor ni ye training no obehwe signs, obehwe symptoms, obehwe evidences, almost evidence based medicine, obehwe a lot of evidence. Now so we conclude say we no eye malaria. Inti obeboa or combination obey bebre in a different people some and all kind of. Inti say if we are addicted to anything seek a professional help. Hospital, hospital is the safest. Because to me, I refer to different people, irrespective of idea air course on who is the right person to refer you to. So for no so little advice. Little advice to Asofo. Enye bibia na spiritual. As a matter of fact, Bible say God laid the foundation of this earth by his own wisdom. I just say even the things they practice in medicine and other fields no means no can make us any spiritual. Because the definition of what is spiritual is our problem. When bibia you view it from you can't say be a spiritual. He view things from God's perspective. Nyame asem in a church say yembom pa. Nyame asem so no say yen keep yonko hospital. Nyame asem no say fedo. Nyame asem so no ka say say. Inti you have to know that obi ba won chen with certain kind of this kind of issues now direct them to the appropriate professionals. Na omuntumi mboa na untumi and solve problem ni.
Me that's it. PV. You wrap up.
Yeah. Nina and your friends say, ya share one say, Bibiano, go hospital first. Near she. Quite was said of fashion. Maybe I still maintain my position. Say, Bibiani, your brain. Once you've been helped, so brain a bit my tiny. Another Kevin from the air one. You are almost halfway through, so bit my head in. I recover. And no power. Will be a way for be a bit much and say, and for her, and you say, but once the fundamental then has not been identified, no. Would the diagram when you was not the initiative to at all. But will be anxious and more any can't find positions to me, saying, a drama mobile we were bushing away, no. Bibi Crow, a idea to have been a course system, a Timao Yeden, a yes, a dear Tina.
I should have be a hereditary.
Mean to me can say yes or no about him. I don't know bipolar for Ubi the Abano or Fadi Abud, Ubi the Abano Pebema another.
Not long ago, a crew hair, Ghana hair. Ma maybe a oko neba. Member hospital needing. Because no one num cook na cocaine, one no more nins and women I won't know. Into a colacato ya wound free your funeral. But that hope for some time now we experience withdrawal symptoms of cocaine.
Wow.
And you see, a buffer for now, the general practitioners were not understanding the cause with the acolano. Unless a man psychologist share what was going on. And then we have to interrogate the mother further. The mother wasn't going ready. No, so Becca said, this is what I'm doing. And so if we feel a bad way, I walk on and waba. Until say quite man, I was one here and a banner to me. And or shred the way I was here, on the banana, son of because me no cook. And immediately, there was a time the pep cocaine be a yellow injection from the wakwalano.
Stabilizers.
One, and I say,
what must I reverse?
Withdrawal symptoms, no, a kuncha is intoxication, no. So be an I so be free home, that's where, and then I say, won't go to me, your professional help. So withdrawal symptoms set in pass, may jai precope. And then papa can say, that is why it comes to say whom be free when a coban say a cofa home ahorodi and whom the getting chain and so betinum. That is the withdrawal symptom stage you see. Say basa na uti anye ya obewu. Even alcoholics, it get to a point at the hospital we have to give them some kakra and sana you stabilize it. But yeah, mouth said the obenum outside and I
complex thing with a simple approach.
It's easy sao.
And therefore for your best time I revisit the issue and now you look at another angle of it. Ada mene Dr. Pearl Edunyako ye a few minutes discussion on her. Na me can say we see a shade nya time near discussing mental health. Idea yem pese ye bosso, but idea edi nya pa. Me I went through it. I'm Roberts. If Oman who may cry, but the direction no more nama on say me shed them on. We saw more attempt to be breaky into the flat.
My friend Chaton should be what we see for.
Naturally.
Yes. Sink of us, but a da. What could you see? Be a Nipan big Jenny Bino. I feel a pan wide. This is the man as a son. Not you're not 10. So is idea. We beat my yimbi and now say, eh, yeah. And you anybody go on, it is will be a yard back, could be or you be near Kanye Jano, a babacunia Kanye Jano.
But PV, my member 1 minute. 1 minute. Obia ne air concerning a dear remedy na oviti, a dear na because that's his problem. Ne how or a 7 o'clock boy. Na all and I'll be catch all say, we say, we are say, we can say for on take that. No bonity, no, I can.
I could say, London Society. Bibianwa Obegay. I was so tears I didn't tell some go home here walker. So tears is a sardian and ya. And I didn't in the money, yes, obey to my guy.
In this case, that person need cognitive restructuring. And by that, everything was set. Next time you shave your metal.
Cognitive, yeah, woman, sound. Cognitive restructuring. Your cognitive dissonance or any cognitive distortion. Say any pay okase odin konkonsa no e kon fa so dwene. On say na make to say brain no left hand side and the right hand side. Say obi e ja na odin konkonsa, it is because the right hand side enye adwuma. Say ye adwuma obi hu say creativity na mani pa na ye den e prosper enye bibi e bia. Ti go to say we nipa 10 bia emu 9 and 8. Right hand side of the brain no
next week Yankopon the chair I would want us to look at forgiveness. Obi say my addiction is forgiveness. I can't forgive someone who has offended or treat me bad. I need your help, please. I'm dealing with an issue Ampao ni willing me time na so onu onya obefri ho ba ontimi
unu ma de kwentia ono hardly tio hardly say say ni pan minim no ba ubi so no beka na hardly say wono obe ye obi bone
anti or expect much from
yes.
Okay me pa mo cho e ha na ye de dwumadie